So in today's class about digestive system GIT diseases, okay, we are going to talk about irritable bowel syndrome. What do you call irritable bowel syndrome? IBS. Irritable bowel syndrome. So basically, what meant by syndrome is in this number of clinical features or clinical conditions are combined together, more than one organ is involved, okay, and the number of multiple clinical features can be seen, okay. So we will call syndrome. So basically, it is bowel syndrome. Means it is irritating of bowel. Bowel means here mostly colon, maybe large intestine initially, after that small intestine. So okay, let's talk about this IBS. IBS. So basically, in the allopathy, in the other pathies, there is a definition given. It is an abnormal neuromuscular junction. What is happened? Abnormal neuromuscular junction disorder. Okay. It associated with abdominal pain and sometimes diarrhea or constipation. So it is abnormal neuromuscular junction. Means in the muscle, in the intestine, okay, the muscles are attached with nerves, nerve endings. So there is happening something happen between this connection. What we will call IBS. So the issue of neural muscles of GI tract, and along with the patient will develop abdominal pain, and sometimes he will have diarrhea. Not there is acute diarrhea. Okay, this is chronic. It will become chronic and chronic constipation. Sometimes he will have constipation, sometimes diarrhea. Alternately, it will change. Okay, so there is no pathology for pathology. If you do the test, scanning, everything is normal. So why this is happening? Because nowadays it is very common disease. In every 10 people, 6 to 7 members are suffering. Why this happen? This is due to the mainly is due to the neuro disorders, means psychiatric disorders. Okay, mainly stress. Okay, stress nowadays very common for single thing. The people are taking uh, stress. Okay, so due to the stress and anxiety, this disease is most common in, in the age between 20 to 40 years. In the age between 20 to 40 years. In the female, also due to the stress, anxiety, and abnormal menstruation or disturbance in cycle of menstruation. These are the cause of IBS. Okay. And what is the clinical features? We talked about the causes, definition. Now, what is the clinical features of IBS? And this, there is a pain in the abdomen. Okay, abdominal pain, but it is not severe. Okay, just we can have pain, crampy pain mostly, crampy pain in the lower quadrant. So we have upper quadrant and we have lower quadrant. So in the lower quadrant area, the patient have pain like cramping pain. This is the first clinical features, and second one is the patient will tell you about sometimes diarrhea, sometimes severe constipation. Okay, diarrhea is also not like watery stool. Okay, he will gain a small amount of stools, small amount of stool in constipation also in diarrhea also. Okay, and the third very important is the smell of the stool is very, the smell is uh, very uncomfortable. Okay, and the patient and the on the surrounding of the patient also feel that smell. Okay, this is very important. In the IBS, you can observe the patient. Okay, and sometimes there is a discharge of mucus in stool. Okay, so these are the clinical features you can observe and ask the patient about pain in abdomen, mostly lower quadrant, crampy pain, and he will have diarrhea. Okay, constipation, very uncomfortable smell. Okay, then even other person will also get uncomfortable. Even he or the person is suffering, and the other person is also uncomfortable. Okay, so these are the things. So there is no particular test which we have to do for IBS, but you will get all are normal. What is related to the nervous system? The nervous system is getting into the mode that it will not ordering your gut to perform his normal function due to the stress, anxiety, or even eating of junk food. Junk food is also one of the cause for this type of habitual diseases. Okay, so but sometimes you need uh, sigmoidoscopy, colonoscopy. Okay, and you know, rectal examination, stool examination. Sometimes colonoscopy, stool examination, and sometimes barium swallow radiography. This will show something if it is problem in, anatomically, okay, but most of the time it will become normal. Okay. So these are the things we have to understand. What are the these are the diagnosis part, clinical features about the disease we understood now. About the treatment. So actually, all doctors will write this, write RX treatment part, but we have to write RM. I think so because these for remedies. We have called remedies. Okay. So we need to improve the connection between central nervous system and digestive system first, and improve the function of bowel and stool process. All these three things very important. So we are improving CMS, BS action, function of bowel, stool process, everything. So we need here some remedies. Okay. F1, S1, L1, WE, or you can use direct F1 WE. Okay. Then you can add S1 into the L1 RE. Okay. Here also in the case of WE, you can add RE also. And third one is S10, L1 WE. And the fourth one is S class plus Y1 or Y2, Y. These are all in B4. Okay, next is C15 1Y. If I'm giving in C15 1Y, don't give S last word to Y. Here only S last is for remove the constipation. Okay. In the sixth remedy, you have the very beautiful combination. Or in the yes, S last, you can add C. In the sixth, very beautiful remedy, which I am advising to you. That is remove the stress. Okay. Then do the sleep also. That is to apply the FTWE to apply on the umbilical cord or on the lower quadrant and also on the forehead or tip of the top of the head. So quadrant, lower quadrant also and top of the head. So this six remedies will give you wonderful results gradually and avoid spicy food. Avoid what are the things we have to avoid? Spicy food, okay, and junk food, and avoid late dinner. Okay. What are the do's or we have to eating on time, taking meals on time, okay, and take small meals, prefer the larger meals, okay, and drinking water 3 to 4 liters according to the weight, and fruits, take small amount of fruits also in breakfast, in lunch, as your convenience, and do exercises. So these are the things will maintain the relation between digestive system and central nervous system. Because our gut is the second brain. If the central nervous is affected, it means digestive system is affected. The digestive system is affected, so it means that the central nervous system also affected. So we have to maintain its function in normal condition. We have to follow this order completely, and we have to follow all these things. Okay. So this is all about IBS. We'll discuss another basis tomorrow. Okay. Any doubts can you ask?